approval of minutes.
So moved.
The second.
Second.
All in favor?
Aye.
Opposed? Okay, minutes approved. Okay, presentation, annual comprehensive final report for the year ended June 30.
It's here. We're ready.
Yep.
I assume everybody got a copy of the act for the last week and a half. Feel free to ask any questions. We have Janine and Phil here as well as David and I. We're from the external audit firm, which I think everybody here knows. I'm going to go through this booklet today. It shouldn't take too long. But if you have questions, slow me down, ask questions, ask what this means or anything you might have. I know we've got a full docket today for this meeting, so I'm gonna go quick, but that doesn't mean if you need to spend more time, I'd be happy to do that. On this first page, the agenda, these are the items I'm going to go through, our team members, our responsibilities, the fact that we are independent, any fraud risk, what deliverables we're required to produce, our methodology with the audit and the single audit, anything significant, and audit differences and some developments coming up. So on page 3, this is our engagement team members. This includes everyone from our firm, Crossland, as well as our partners, our DBE firms with Kim Thomason and Sarah Hardy. They're incorporated in here. They're one of the full team. We don't really separate the work into different buckets based on what they do and what we do. We just incorporate everybody. So they handle a significant amount of this audit.
These are the management team members. We have obviously seniors and staff that support all that.
Right. Page 4 is our responsibilities. It seems very easy. You would assume what our responsibilities as opposed to management's responsibilities are, but we explicitly state that here on page 4. Ours is to express an opinion about whether financial statements are prepared by management under the oversight of this committee, and that they're fully presented in material respects and conformity with GAAP. We also our responsibility is to perform the audit in accordance with government auditing standards and uniform guidance. That addresses our single audit, our audit of the federal grants. We're required to maintain independence in fact and appearance, and to have an attitude of professional skepticism. And then we're required to report to this committee anything not limited to, but significant deficiencies or any instances of non-compliance or certainly any fraud detected. Now, management's responsibility is to fairly present the financial statements in accordance with GAAP, adopt the proper accounting policies. Remember, these are just things that we're auditing. Establish and maintain effective internal controls, prevent and detect fraud, and disclose to us or this committee any deficiencies that they found. On page 5, the AICPA's Code of Professional Conduct Rule 101. That's the guide that we follow as far as what makes us independent, as well as Government Auditing Standards Chapter 3. So again, we have to be independent in fact and appearance, and we are. And one of the requirements is to confirm to you that we are. On page 6, addresses fraud risk. The AICPA issued SAS 99 to address risk of material misstatement due to fraud. Really, it's kind of a 4-step process we go through. We gather information. We're brainstorming amongst our team. What kind of areas are susceptible to fraud in this industry, in this size entity, and based on how management's set up, how we do that. We inquire with management, not just in the finance team, but across the entire government. And we're looking for unexpected results, anything that's unusual in nature. Once we look at all that, we respond to those identified risks that come out of that information, and we design procedures that we do, whether it be testing, journal entries, or looking for things that are generally above our scope, we might look at smaller items, just looking for anything that's fraud-related. We test for management override, review current and prior significant estimates. We look at different rationales on estimates and manual journal entries, if there are any. And then finally, we evaluate all the audit evidence that we've looked at. And we disseminate these results to our audit team. If we found any, we would obviously be required to communicate that to this committee. On page 7 is a list of our deliverables. Today's meeting is, this is the results of the annual comprehensive financial audit at the top, the ACFR. We also will issue a report on General Hospital by the end of this month. We have MNPS internal school fund financial statements. These are all unmodified opinion. And the single audit is in progress right now. Other deliverables require communication to the audit committee. That's what this is. And a management letter. We usually have, well, once we finish the single audit, we will have a management letter for this committee and present it to you. Of course, we will have already gone through that management letter with all the different departments where we might have a comment and give management the opportunity to, sometimes differences work out and it's not really a comment that's worth noting. And sometimes if it is, we get an agreement with management and of course they have an opportunity to respond to it.
And the reason we wait until we finish with the single audit is because if there are grant compliance issues, that would be included as well. And so
So does that mean you don't do any auditing or even looking throughout the year? You just wait until the end when you're doing the audit?
Well, right, because we're auditing the financial statements as of June 30, 2021. So we wait until that year. Of course, there's tons of planning procedures that go on before that June 30, but most of our auditing is between, the last 3 months of the year and into this year into January.
So what we're providing an opinion on is whether the numbers in the ACFR are properly stated, fairly stated in all material respects.
Right.
Now, items such as compliance through the year and things like that, we look at compliance with laws and regulations as they relate to the ACFR.
Mm-hmm.
But, internal audit, is mainly the one that is, that does, are things operating correctly. We do look at internal controls. We do test controls with various transaction cycles, but
Is that once a year, or is that throughout?
we take a sample throughout the year.
Okay.
But we do it when we do our audit processes.
So we're testing the activity from the entire year.
Yes.
Okay.
We're just all doing it at
Right.
one period of time. For as large an audit as Metro government, it
Right.
takes several months to audit
Exactly.
that one time a year.
Exactly. That's what I was thinking.
Yeah,
I
our
just wanted to
process
make sure,
starts
just-
in May and goes through December,
Right.
so.
Just wanted some clarification. Thank you.
And then the data collection form is the last deliverable, and that's where the federal grants from the single audit are uploaded to a federal database where the federal departments can see the results of our single audit. And that, of course, that will be done at the end, conclusion of the single audit.
And a quick question, you may just prefer to defer this to the next meeting, but do you anticipate at this point in time any material weaknesses or significant deficiencies?
Hard to tell. I would
Fair
prefer
enough.
to defer it. Honestly, because we really haven't been able to fully vet any potential comments with management yet, and I would, especially since we're in a public meeting, I think
We'll revisit this the next time.
revisit that, yeah. Page 8 and 9 are our audit methodology and approach. I mean, the first one is a chart format. The four main parts of the audit are the audit planning and risk assessment. Like David said, I mean, that's the May, June, that's pre-year end that we're assessing risk, because everything in a financial statement audit is based on risk. And our assessed areas of risk. Those are the areas that we're going to focus on, and that's how our planning is around that area. Once we look at where those risky areas are, there's two things we can do. We can test control, evaluate controls, and test based on those strong controls that are in place, and Metro government has plenty of strong controls in place. And then sometimes it just makes more sense to do some substantive testing, and so a combination of those two are generally what we do. And then the completion and reporting is this phase of the audit at the end of the year. On page 9 are some examples of what we do with control testing and substantive testing. So your control testing are like your cash receipts and revenue. Property tax billing and receipts obviously is a very large one. We're looking at purchasing, we're looking at bank recs, and we're testing the controls around those, not necessarily the activity, because those controls are in place and we feel that they're strong. And if you test the controls over and over to a certain stats sample and everything works out, then you can make the assumption that those areas are strong. Now, substantive testing, like long-lived assets, if you're building a soccer stadium, it makes sense to go look at invoices that you're spending on the soccer stadium, or investments. We can very easily confirm with a third party what that investment balance is. We can price test, or the OPEB. We can or look at the actuary report. Of course, analyticals are a part of any substantive testing, whether if we're looking at grant receipts or disbursements or property and state tax and other revenues. Of course, then we have compliance testing too, and that's mainly in our single audit. Page 10 addresses our single audit. So for 2021, Metro government is a low-risk auditee, which means we only have to cover 20% of the total federal expenditures for the year in our testing. If you were not low risk, we would have to cover 40%. The major programs that we are currently tested are listed right here on page 10. So we have 2 in the Department of Education, 1 in Homeland Security, which is all the disaster relief funds, the 97.036, and then 1 in Health and Human Services, and then Treasury.
And we also have one that's not listed here that relates to the hospital, the provider relief funds, that we're also testing those grant funds as well.
Is this the first year for low risk in a while, or last year?
I think it's our second year. Metro was high risk for 10 years before that. Yeah, and then the last, I think, 2 years.
And the reason for that
We were
was?
low risk. Well, it's largely based on if you had a material weakness in the last couple years, and Metro has not. And that's.
And for several years, it was because the hospital was a going concern, or it had a going concern issue. And once that eliminated.
That's kind of what I was trying to get at.
Right. And that was a new designation a few years ago as being high risk. It wasn't 5, 6, 7 years ago. And as soon as we got over some of the material weaknesses for some of the funds, we had to unfortunately stay high risk because of that. And then once that went away, we were able to.
Good.
This is the test you're just speaking of.
I'm sorry?
The test, you're talking about, were you asking about the test, the second test that you all were doing?
The
Because
single
of that.
audit?
Uh-huh.
Is that, you're right.
For the
That's correct.
hospital?
Well, it relates to federal. It relates to federal grants, and so we test grants from all over. The hospital has had a large one this year. This is the first time they've ever had a single audit, because it's the first time they've ever received federal awards, and so, but they exceeded the threshold, and we were required to test that grant along with several, 5 others with just regular Metro education, whatever it might be.
Okay, thank you.
Page 11, we just listed a few of some of the significant areas. Grants, testing expenditures, and reimbursements, compliance testing, that's mainly your single audit. But, there's always, in debt, when there's new general obligation bonds, there are couple refundings, sports authority. So, those were significant transactions that we did a lot of testing around, as well as capital projects with the soccer stadium being built through the sports authority. Page 12 are the accounting pronouncements adopted. I won't go through those in detail. The fiduciary activities, 84, changed the presentation of the report a bit in some of the fiduciary activity funds. The major equity investments, basically, that if there were major equity interests, then they would have to be reported as a component unit. And then 98 really is just the changing of the name of the report. Now it's the Annual Comprehensive Financial Report, which I've been referring to as the ACFR. Page 13, accounting estimates. Every set of financial statements has estimates. We look at those estimates to see that they're in compliance with GAAP, 1, and 2, that they're presented fairly. We believe they are. We do read all unaudited information in the ACFR. We do read all that information noted, and we know nothing materially inconsistent with what's included in the basic financial statements. The next several bullet points are required communication points under our audit standards. No transactions for which there is a lack of authoritative guidance. All significant transactions have been recognized in the proper period. No alternate accounting policies or practices related to material items. No difficulties encountered in dealing with management and performing the audit. It went very well. Obviously, you have a very strong finance team, and it went very, very well. No disagreements with management regarding any auditing or reporting. Management will provide us a management representation letter repping to us that everything they haven't withheld anything from us that we've asked for us to properly do our audit. And we're not aware of any communications with other outside accountants, which is okay. We just want to be part of the conversation to make sure all the relevant facts are there. Page 14, there were no unrecorded audit differences in governmental activities or business type or water and sewer. Page 15, I won't go through these, but I think it's on page B39 in your ACFR. If you want to some other time go through these are all listed in your comprehensive report, and it's just upcoming statements. We just want to make sure the audit committee's aware of what's coming, and we will be looking at these along with management. Some of them we already have to make sure that they get properly adopted in the year that they're applicable. Finally, 16, we list our contacts. We list that because we want you to call us if you have any questions anytime throughout the year. We're always available. Have any questions?
Need opinion, right?
Any opinion? Unmodified.
Okay, questions, comments?
Yes, are you John or Dale?
I'm John.
Okay.
He's a younger version of Dale.
Dale is usually here.
He is.
Thanks for getting this to us. As promised, a week ahead of time. So we're open the floor for any sort of comments. If none, we don't approve this, we accept it, because our review is not one to do it pre-audit. So is there a motion to accept the,
I move that we accept the audit results presented by Crossland.
Second.
any further discussion? All in favor?
Aye.
Any opposed? It's accepted. Thank you.
Here's a quick
A lot of hard work.
Just for the rest of council members that are part of this committee, I know you have to sign a letter and kind of build the document, but timing-wise, when would that be something I could circulate to the rest of council?
We're looking, I think, Janine, the printer, we're talking about the 21st or 22nd
Okay.
of having we'll put our opinion, now that's been accepted, we have to put our unmodified opinion in here and sign it. And then print the report, final, and I think we're looking at the 21st or 22nd to do that.
Would it be, and I'm sorry, but thanks for indulging me, but would it be appropriate or would make you uncomfortable? I feel like I at least need to share it with the chair of Budget and Finance, a version. And could I circulate PDF of this version without your letter, it makes me uncomfortable that we're having a public meeting and she hasn't seen the document, but.
Yeah, sure.
Without our letter, you
I
can
mean-
do whatever you want with it.
Okay. I mean, I'll caveat it that it's not final, and it's
Can
not final
you-
until it's final, but
Coordinate getting her a PDF? Okay.
appreciate it. Thank you.
Absolutely.
Okay, next item. Thank you, John.
The next item is the audit of Public Works revenue collections. It's a slightly unique situation. We started this audit and there was a Public Works, but in July of 2021, Public Works became the Nashville Department of Transportation, and they moved some of their functions, their prior functions that would have been under Public Works, such as solid waste collection and convenience centers. They moved those to Metro Water Services through an MOU. So, with that, some of the recommendations in here, you'll see multiple recommendations between the departments, but there's coordination amongst them. So, with that, this audit was put on the audit plan as we have focused a lot this past year on revenue collections, primarily focusing on types of cash collections since they're a high-risk area, and revenues has kind of been at the top of Metro's mind for a little while now. So when we started this one, we went and we looked at all of the areas in Public Works where collections were being made. We noticed some controls in some areas, but we did notice a very high risk around convenience centers. So much of our work around collections focused on the convenience centers, just due to our time constraints and our own staffing levels. But those collections then filter into one area where it's all recorded, and those revenues are recorded with other revenue streams such as transportation licensing and permitting and other miscellaneous areas. So when the recording piece of it, when we started looking at that, we did look at different pieces other than just the convenience centers. We had two main objectives with this audit, which was to see if the revenues were had controls in place to make sure that they were complete and recorded properly and timely, and deposited timely. And the second one being that they were safeguarded and monitored. Unfortunately, we did have to put a scope limitation around the first objective. Since there was such a lack of controls at the convenience centers, we cannot say either way. Unfortunately, it just was with cash, and there's nothing to track it. It makes it a little hard to put any type of yes or no on that. With the second one, with monitoring and safeguarding, we did not find that there were sufficient controls to do either of those. This audit ended with 5 observations and 16 recommendations. 6 of those recommendations going to the Department of Transportation and 10 going to Metro Water Services. Briefly, what those observations were, the first was tracking chain of custody of the cash collections. The cash itself would change hands multiple times, but we didn't find the sign-offs to say that this is how much I'm giving to this person and so on, so that if the cash goes missing, then we know where it went missing. So we would like to see controls in place to make sure that there's chain of custody. The second one related to the lack of controls around recording and segregation of duties. When all of these funds were going to one person, all these revenue streams were going to one person within the finance administration area of Public Works, and that one person was counting the cash for the convenience centers, not necessarily for the other areas, but at least for the convenience centers. That one person was then depositing it and recording it. There was no independent verification or reconciliation being performed, which means that if something was incorrect, nobody else was looking. The next one, we did look at some deposits related to that. We found some discrepancies in the deposits. A lot of times it was a handwritten note to say what was the difference. This convenience center was short, or there was a refund, but there wasn't supporting documentation of those. The next one was the actual system that's being used out of the convenience centers. There was the permissions for the users that were using that system weren't the least that they needed for their job. We normally like to see that the people that are using a system only have as much access as they actually need. For instance, the person that was working in the finance administration area, who's doing the counting, the depositing, and the recording, this person could also go in and delete data out of the system as well as void it. We did do some alternative procedures. We found no evidence of that happening. We looked at ticket numbers. There weren't missing ticket numbers. There weren't any voids that we saw, but the opportunity was there. As well as the convenience center employees themselves could void transactions without a management review or anything like that. The next observation that we had was just a lack of controls at the convenience centers. These convenience centers are one person working at a booth. And as the person comes in, there's procedures that are in place, but even from observation, these procedures weren't being followed. Individuals were coming in without their residency being checked. Well, that meant that we weren't tracking the number of individuals coming into the convenience center. Sometimes this means that there's just a $0 transaction, and for efficiency purposes, those individuals at the convenience centers were letting them come on without taking the time to slow down the line to check up for their identification. As well as, these individuals at the convenience centers are only accepting cash or check. There's no credit card option or any more secure way to pay. Receipts are only provided if they were requested. So from our observation, 4 people came in with $0 transactions, and it wasn't until the last person who had something to actually pay was actually put into the system. Lastly, we also there's no cameras in place, so there's no monitoring of this. And there's also, at the end of the day, one person is counting the cash that they've collected for the day. So there's no accountability around that. The last observation that we had related to a safety issue. It's not currently in this workbook. It's not on the public website, just because of employee safety in transporting cash. But there were safeguard issues around transporting of cash that have been communicated to Metro Water Services and Department of Transportation, and recommendations around that. So that was the last observation that was in here. As I mentioned, there were 16 recommendations. All were accepted by both Department of Transportation and Metro Water Services. They've started to implement those recommendations already as well. Today, so that's my spiel, but today with us we have the Director of Water Services, Scott Potter, the Assistant Director, Amanda Deaton-Moyer, and the Interim Director of National Department of Transportation, Faye DeMassimo, and then the Auditor in charge for this, which was Mary Cole. Are there any questions?
Any questions?
I feel some kind of way. I'm the only one asking questions. But I'm wondering about the accountability. Who was held accountable for the lack that was detected by you? And what actions were taken as a result of that? Because we do have another issue that occurred in Metro Water that I'm wondering if that could have been anticipated and mitigated, considering the things that you just said.
As far as accountability, as I say, we'll let Faith speak.
So, since this started as a part of Metro Public Works before we made the division and so forth, and it described it as you talked about, subsequent to this, we've addressed all the necessary personnel actions that were related to what occurred here, including bringing Amanda Deaton-Moyer on assignment for the implementation of a number of the corrective actions. You mentioned on the corrective actions list, all the ones that are attributed to NDOT have been implemented and are continuing to be implemented. And again, the necessary personnel actions that are associated with accountability have been undertaken.
It has been what?
Undertaken. It's been implemented.
So is there going to be any specific reporting on what has taken place?
I mean, there was a department level personnel action that was undertaken.
And then what will happen is, since they've reported them as implemented, we will go back out eventually and find out specifically what was done. We will make sure that it was properly implemented through a follow-up audit. I think in one of your emails to me with this one, with the significance of some of these observations and then how long some of the secondary phases may take for water, we might go out earlier and make sure the implementation of these happens instead of waiting until all of them have been implemented like we typically do for follow-ups.
Well, I guess I'm just trying to find the consistency Because if some things happen and people are held accountable and disciplined in terms of suspensions or, without pay or terminated, whatever the case may be, in such instances as this, I'm just wondering if that same type of penalty is across the board. And that's all I'm asking, is just, is it consistent in the actions that we take? And I'd like to know what.
Yeah, I believe it was consistent, but we did undertake a significant disciplinary action associated with the recommendations and the results of this audit.
With whom? I mean, am I out of order for asking? Or is this another meeting that we should have away from here?
I don't know if we discuss, and you all will have to advise me, I don't know if we ever discuss specific individuals like this.
We typically don't discuss the HR issues, but the questions, I don't know if they've ever been raised. I don't know if they're even allowed to be.
Yeah, it might be better to have a conversation to set up a conversation to discuss the HR perspective and proceed with the audit piece here, and then meet with these guys to talk further about what happened to sort of take care of that piece.
Okay.
And we can help coordinate
Not
that.
trying to be forthcoming,
Yeah.
obviously, but just trying to understand.
While she's here.
Exactly.
While she's here.
I'm just trying to understand, and if I'm out of order, please share. Let me know.
No, I think it's good to ask questions. I think as far as the agenda is concerned, maybe just we'll focus on the piece that they investigated, and then if there's follow-up questions, then yeah, please get with these guys, and I'm sure they'll gladly add that.
Because right now the audit really showed there's been just the process was flawed, not necessarily there was any evidence of anything else.
Yes, we found nothing of any
Which-
fraud or any theft.
But anyway, it does look like it's some basic segregation of duty, except for the cameras, which I understand that could be some financial, ramifications. But these are pretty quick turnarounds that you can do a follow-up in a few months.
And
See
admittedly-
if it's getting off on a good start. And segregation duty, if you have the manpower, it's fairly easy to implement.
And Metro Water Services, for their piece for the convenience center, has undertaken a lengthy, 3-phase approach to kind of address certain things right now, but then also make sure that even going forward, that things are more automated and that they're taking out even some of the risks so that they don't even, like, putting in credit cards and things like that.
This is a good report.
Just to your point, and maybe these are already done, but some of these things, December 31st, and this report's been out since November, it's a 5-minute process to find somebody else to double count the cash. Like, it makes me a little nervous that 60 days later, we still haven't solved for that.
It's solved.
Okay.
These are the initial estimated times, so
We
Yeah.
always give ourselves a little bit of time just in case something crazy happens, but
No,
we are
it's-
double counting
I-
cash, and we have
I would
we have
imagine.
done a lot of those things. We changed the time in which it's open so that there's time for the employees to double count. Different deposits are taken at a safer time and in a safer way. It's actually not transported in the same way. I mean, I think if Lauren came out today, she'd find a completely different process than she did, but she would still find a few things, like we aren't taking credit cards yet because we're adopting different software. We plan to. There are some counting issues that the software will solve as well. Our ultimate goal is to have a process kind of like kiosks where people go in, they say what they want, and someone helps them put it in for the accountability piece, and it's all taken in one place. So there is a pretty detailed plan, and we were allotted some security money in the CSP to take care of that piece as well. So it is well on its way, taking it very seriously.
I would just encourage you to make sure that the Metro Treasurer is engaged as the custodian of all cash.
Yes, ma'am.
She really needs to be part of this.
Yes.
Any further questions? Okay, let's go to the next item. Thank you.
The next one is a pretty quick one. It was the follow-up audit of the physical security at the library. This audit was originally issued back in May of 2020. It was just an audit where we looked at the physical security around the libraries and the assets in the library. What we found was we had 4 recommendations related to this one. 2 were high risk, 1 was medium, and 1 was low. The library reported all of these had been implemented, so we sent Nan Nguyen, the auditor in charge, back out to check. She verified that all implementation had occurred and that all of these could officially be closed.
Any questions? When was the original audit finished?
It was finished in May of 2020.
2020, and now within pretty much a year. That's excellent. Anything else?
The next one is the investigation into allegations of Nashville General Hospital. A little background on this one. Back in June of 2020, the former finance director made some allegations about CARES funding received by Nashville General Hospital and the reporting of it to Metro during budget season. These allegations gained some media attention, and with that, our office got a lot of phone calls from individuals associated with Nashville General Hospital, with other allegations that actually had nothing to do with the CARES funding, but just other allegations. Since these allegations originated with somebody on our audit committee, we wanted to make sure that the appearance of independence was maintained. So we utilized our contractor, Barry Dunn, who is out of Maine, Boston area, up there, up north. They're in multiple places. But we utilized the contract with them to investigate the allegations.
You had to pay them?
Yes. Yes, they're one of our contractors that we have. We have 3 contractors on file to utilize for investigations or for audits.
So what's the difference of them in Crossland?
So they are going to do investigations or internal audits, whereas Crossland is going to do the external audit of the financial statements. So this was more of an investigation into allegations of fraudulent use of, or fraudulent reporting of the CARES funding to Metro.
Very done while they're independent. They work with you.
They do.
They work kind of for as an extension of the internal audit staff.
Yes.
Crossland is independent.
And Crossland is local?
Yes,
And they are not?
yes.
Okay.
But anyway, they're just independent auditors. The other accountants or auditors just work as an extension of our internal audit staff, and we have a separate budget to do that.
These particular allocations would have no effect on the financial statements, the ACFR there, per se. So, I mean, that's not something that's kind of outside our scope.
And if you thought it did, you would get in the middle of
Yes,
it.
if we thought it did.
And we let them know about it when this.
They kind of write their own program.
Oh, well,
They
you know,
kinda-
I
they
just
do.
like to keep,
But that's part of our assessment.
I just
not
like to
procedure.
keep local money local. That's
Yes.
all.
Well, we do, I was gonna say, our other 2
That's-
contractors
I
are
like the sound of that.
local.
Yeah, we're all for that.
I was gonna say, our other 2 local contractors are local, and in
Headquartered
fact,
here, I think it's fine.
Barry Dunn's, our minority business is local, that was used on part of this allegations. But what we tasked Barry Dunn with was reaching out to those individuals that had contacted us, determining which allocations had predication to actually be investigated, because we had a lot of varying allegations. What Barry Dunn came up with was 2 overarching allegations. The first one being fraudulent reporting of the CARES funding to Metro. This had 3 sub-allegations. The first sub-allegation was that Nashville General Hospital did not report the receipt of $9.4 million in CARES funding in a timely manner. Barry Dunn substantiated this finding, or this allegation, but they do note that the word timely is subjective. From their perspective, 7 days that it took to report could have been shorter. So that was why they substantiated this one. The second sub-allegation was that Nashville General Hospital broke a law, a rule, procedure, policy, anything that would have been in place by not reporting the information timely. This was unsubstantiated. There's no agreement, there's no documentation or anything that says that Nashville General Hospital has to report any of this information. It's done in good faith. Third sub-allegation was that there was ill intent and that this was not reported timely in order to affect the budget. since the budgeting process was going on at Metro Council at that time. This was also unsubstantiated. There was no evidence that was found to show that there was ill intent of not reporting this earlier. So that was the first main allegation. The second one was about the operations, just the general operations of Nashville General Hospital and certain aspects of it. This also had 3 sub-allegations. The first one was that non-credentialed providers, meaning those providers that may be new to the hospital that had not gotten their credentials yet for the hospital, were providing services, but they were using the sign-off of credentialed providers.
Sorry, what do you mean by provider?
Provider, so if you went to see a nurse practitioner or physician.
Doctor wasn't
Yes.
certified?
Yes. And so they were saying that this was being signed off with an already credentialed employee, without their approval. This one could not be determined. A full population was requested of both Nashville General Hospital and the clinics for the period of time under the investigation. Barry Dunn did not receive the full population. The population that they did receive, they did not find any issues, but since this is an instance that could happen even one time within that period, they were unable to say whether it was substantiated or unsubstantiated. The second sub-allegation,
So he made a request for certain
yes,
cases, documentation.
Yes.
He did not receive all of that.
that's correct.
Would it be appropriate to assume the ones he did not receive are the ones that there was a problem with?
There was back and forth communication between Barry Dunn and Julie Groves, who's the Chief Compliance Officer. I don't think that they ever thought that there was ill intent. That's actually one of the reasons for the recommendation at the end about evaluating kind of the staffing to make sure that the capacity is there to provide all the information necessary for these types of things, as well as to perform the day-to-day operations of the position.
What were the reasons given as to why some were not provided?
That I honestly don't know.
I'm happy to either answer that now or at the end when you finish, either whichever you would prefer.
Go ahead.
So our position is that we provided all of the information that we had that was in our possession that they had requested. I would like to make sure that there is an understanding that there is a distinction in our hospital between credentialed providers and financially credentialed providers. Credentialed providers are those providers, nurse practitioners, physician assistants, MDs, etc., who have privileges within the hospital to see patients. However, financially credentialed providers are our employed providers that we submit claims for. And that is what, even though they refer to credentialed providers, it would have been the financially credentialed providers that the allegation was regarding. We have less than or right at 20 of our own providers that are financially credentialed. And we provided a list of all of those. We then provided a full billing list of all of the physicians who have bill for patients in our hospital. All of the providers who are not our employed providers, they bill for what's called the professional fee. That's for the physician's fee. The hospital's only allowed to bill for the facility fee because those providers are not financially credentialed by us. So we did provide, in our opinion, everything that Barry Dunn had requested of us that was in our possession.
So if you provided everything that he requested, why is he saying he didn't get everything he requested?
I cannot answer that.
So, I don't know, look, may I ask a question, and I know I don't look this old, but I worked at Meharry Medical College for 17 years, and when they had a Meharry Medical Group, and they were basically separated. I don't know if this is a situation where they still, they're necessarily Meharry doctors that provide services at Metro General. So would it have been appropriate for Meharry to possibly provide that information? Because you wouldn't have it necessarily?
Well, I can tell you that the allegation that this stems from had come to my division first. It had been reported internally, and I'd completed a full investigation into it. The two providers that the allegation was around were both employed Nashville General Hospital providers. And they were both listed on the report that was provided to Barry Dunn as financially credentialed and when they were financially credentialed.
I think this is just an open question we have back to Barry Dunn. We can't, I don't think we can resolve it here, we just did it, it's a question. And let's just, we'll ask that and get, have a follow-up. Fair enough? Fair enough.
The next sub-allegation was related to the intentional overcharging of a substance that is administered during a stress test called Davidson. And there was an allegation that this was being charged twice to patients instead of just once for the stress test. What Barry Dunn found is that they unsubstantiated this because the way that General Hospital actually bills this is as a bundle. So it's a bundle of services together. So Davidson could not have been double charged since it's part of a bundle. And in fact, the way that General Hospital was billing this was to the detriment of General Hospital. So this one was unsubstantiated. The next and last sub-allegation was related to, was kind of a two-part. The first was that the chief compliance officer was not performing proper investigations into complaints, and then also that retaliation was occurring to any staff members that lodged complaints. Barry Dunn did substantiate the first part of that, which that the complete investigations were not being performed. The reason being that they could not confirm this because the documentation related to those investigations was not being maintained according to the policy that they saw, which was for 7 years. They also interviewed some individuals related to some of the complaints and noticed that some individuals may not have been interviewed during an investigation into a complaint. The second part of that about the retaliation against individuals that make complaints was unsubstantiated. They found no evidence that individuals were being retaliated against. In fact, they think that it stemmed more from a misunderstanding of how the policy works and how leave of absences are happening and the conduct of those actual investigations that may have made employees misunderstand some of the process. So those were the three, total of 6 sub-allegations that were within this report. As Julie Groves, so Chief Compliance Officer here from Nashville General Hospital, as well as Dr. Joseph Webb and Bruce Naramore, who is the Chief Financial Officer. Barry Dunn could not be here because they are not local and because of the pandemic, but as noted, I will send any questions back to them if y'all all have questions.
So is this typical for Metro to call for an investigation on a department that they actually oversee?
It is not. This is kind of an abnormality for us. Normally, if we get complaints against any department or allegations against any department, they're usually coming from outside sources or staff within the department. This was a unique situation where it was an audit committee member, and so that's even why we utilized an external person. So no, it's not. We do get allegations often from internal to Metro or internal to General Hospital. So that is a common thing, and we do perform the investigations if we find that there is a reason to perform the investigation and that it's large enough that it warrants an investigation.
But it doesn't typically come from the finance division?
It does not, no.
Okay. And I just also happen to have been chair of health and hospitals for the council during the COVID and things that happened.
Okay, thank you for the conversation. Any further, this report's been out since mid-November, so it's been public.
Yes.
So I assume if they had any questions, it would have been brought up already.
I think you said for B3, the substantiated portion, the reason they substantiated was because they weren't maintaining records in adherence with their policy? Is that right? So why is the recommendation then?
Well,
they
there's
have clear
a piece
procedures?
of the policy about the retention policy being that you're going to maintain records for that. There weren't records behind it, behind the investigations, or at least deep enough records that they could substantiate it or unsubstantiate it. So there's some policy around pieces of of it, but the actual policy about how it's investigated was not clear. And so putting form around that. Maybe.
I guess I struggle with how it can be both ways. Like, if you had a policy and you didn't follow it, then I understand substantiating it. But if you're saying the policy wasn't clear, then I don't know why you wouldn't lead to unable to like, why would that not be unsubstantiated? It feels like a little bit of both.
That I can ask them.
Unable to determine.
Yeah, like, maybe that's a better answer, but
And I kind of
it
feel,
kind of leaves you in a weird place. Like, you've been substantiated because you didn't follow the policies, and the directive is to fix the policy, and I don't really know how that helps you.
right.
I don't think that would help me.
And I kind of feel the same way about A1, considering that 7 days is subjective in terms of reporting it, because it actually was reported, was it not? And were they given a timeline that they were supposed to report? Is there a timeline?
There's not.
Set?
There's not, and that goes into the second one.
Yeah, I mean, it's their report, but they need to be clear one way or the other, because that's not necessarily what was, it didn't say 7 days was subjective or anything like that. It just need to be clear of what, when they say
It does mention that it is a subjective, let me see which one
Yeah, I think I
it's on-
read that
it's on
in
page
a letter
8.
or something.
I say, on page 8, it does say that all timeliness is a subjective terms.
anyway, I mean, okay. Thank you. Any other questions? We appreciate you guys coming.
So would this be
Any
treated the
comments?
same way you would a regular one, where you'd kind of put a timeline for the recommendations? and
So
implementation?
investigations are a little bit different. Usually, with an audit, we get responses back from the process owners on when they'll implement things. Investigations historically have always been treated as if recommendations were seen, then we expect you to implement them. With the issuance of this, we would work with General Hospital to kind of come up with and work together. And yes, they eventually would be followed up on and kind of put a timeline around it. But this would involve multiple people, especially with the different types of allegations that came out of it.
Yeah, it's like the finance department got an assignment out of this.
Yes, yes, exactly.
Okay, thank you. Next item.
Okay, back in April of 2019, our office did a audit of the EEOC Form 164 reporting process. That's the form that our Human Resources Department has to send to the EEOC twice a year, basically giving information on our employee base. There were 3 recommendations in that particular audit. Jim Carson, who was our in charge, went out. He looked at those 3 recommendations. They had been implemented and they've been closed.
Okay. Good follow-up. Any questions, comments? Good. You want to work on it?
Yes, just like the last meeting that we have another audit senior that is coming off of a project, and because we are so far into our audit plan, we need to move something from from the other potential audits that were listed, over to the actual audit plan, so that our audit senior has a project to work on for the remainder of the audit plan year, which ends in February, or at the beginning of February. We looked through the other audit areas, and from our perspective, we think that looking at or moving the audit of social services, homeless impact division would possibly be a good audit to move to the audit plan. It's very pertinent and to what's going on right now, and it's an area that we haven't looked at in a very, very long time, as far as I can even remember, because the last time we went to social services, we did not look at the homeless impact division. So we would request moving that one.
So our potential is on page,
So unfortunately, not page
blank.
numbers on there.
Second line. And you wanted to move,
We would be moving item F.
yeah. Any comments?
I get it. So did you all audit the homeless impact division when it was up under MDHA?
Not that I can remember.
So I pride myself on knowing almost nothing that's going on in council. But I feel like, wasn't there talk about
Yes.
an ordinance to create? So is that in concert or conflict with
Yes.
this?
Well, it's one of those things that was deferred because it's going to require a budget. And then, so if it does eventually move, it wouldn't be moved until next year. But there are processes in place going on right now. There's multiple parties involved if you think about it, because it's not just in social services where homelessness is being addressed, and looking at the communication between social services in those areas.
And it's hard, because there's a lot of discussion right now as far as whether or not the city is doing all that it can through the Homeless Impact Division, and how to make those processes as well as the services performed by that division make it more efficient and effective. So it's pertinent.
So you would agree with this?
Yes.
Okay,
So would I.
okay. Yeah, what you were asking about investigations, or Hank, one of the things we do is approve the audit plan and any changes to that audit plan. So you would have input to it. So is there a motion to change the audit plan for this year to include this?
So moved.
Second.
Any discussion? All in favor?
Aye.
Done.
The next item is the audit, our current status with our audit projects. We have 9 projects that are currently going on. 3 of them are in the draft reporting phase. We've issued 16 audits for this year with a goal of 17. And then we've issued 1 investigation. No, we did not receive any hotline calls or anything for this past few weeks since the last meeting, so that didn't change. Are there any questions?
No, I just think what you all are doing is awesome. I mean, it is just.
You know what the most fascinating part is? And so I sit on a lot of boards, and they show up at a lot of them. And these two can do every finding in order without reading the notes. It's the most.
John just mentioned that.
It's the most
Today, and I was
right,
like,
right.
I don't think she's looked down at like an hour.
I have notes.
Going from public, I can't even remember whether this is NDOT, Public Works, or whoever it is, you know? It's amazing.
Yeah, it really is.
Absolutely. Good job.
Yes,
Thank
yes.
Okay. The next item is the recommendation implementation. This also has not changed much since the last time you saw it at the meeting last month. We only had 2 recommendations that were supposed to be implemented by 11:30. Y'all see a lot more, hopefully, at the next meeting, because 12:31 tends to be a popular time for people to put their recommendation implementation. The 2 that did come up were related to the Public Works Revenue Collections audit that we just talked about. And those were implemented, as Faye and Amanda both spoke to. The next piece is our 2022 meeting schedule. This was put together in the same format as the one as it has been in the past couple of years. The only change on this one was I moved the November meeting up earlier into November to kind of avoid Thanksgiving holiday week. But other than that, it stays the same. We didn't move the December meeting only because in order to give Crossland and Finance time to get us a pretty finished draft, leaving it later in December or the middle of December was better.
While we can approve this, I think it's, the 13th is like the end of the year. Even if you move that a week to give you another week to get that, to get people here, so we can have this. And I don't mind, we can do this the same way. You get it out a week earlier. We come in here and we don't have an executive. Our executive session is probably going to be in November anyway, about anything you find. But getting it, just like moving it outside Thanksgiving week, getting it outside this week would be beneficial if we can. It's a lot of work in this little.
Well, I think historically, that has been the case.
But anyway.
Right, I think there was some extenuating circumstances with transition.
I mean, it is what it is.
Right.
We'll do what we have to do. Okay, is there a motion to approve 2022's audit committee meeting plan?
So moved.
Second, all in favor? And everything's good on the budget.
I was about to say, the last thing is that we're at 30% of our budget.
Yeah.
And this is heavy too, so.
Exactly. Some light reading.
Okay.
Tell me this, how have I only been here 8 weeks and this is my 4th one of these meetings? But there's only
It's
6
the end
meetings
of the
in
year. It's the end of the year. You can blame it on them. Executive sessions.
Any need for executive session? Any other, well, see, we don't have any other agenda items. That's when Terry would say there's no other agenda items.
There's no other agenda items.
So we have to quit talking. A motion to adjourn.
So moved.
We're adjourned.
Thank you.
Wonderful.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.